Hi, good morning Francisco. My name is Sasha McGrath. I'm your invigilator for the OET speaking session on the 28th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Francisco Mekazi.
And what is your candidate number, please?
My candidate number is 232891110.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me about a time when you were required to use a form of written communication to express your ideas. How did you do so effectively?
Throughout a given shift, we are using both verbal and written communication with each other, patients, staff, as well as in our charting. But one time, that really stuck out to me was with a patient who was deaf. We did not have a sign language interpreter at the facility, and everyone was wearing masks at the time, so lip reading was altered. We began writing messages to each other to best suit the patient's needs, until we could get a sign language interpreter set up by video chat. The time it took to write everything down and explain certain results was nothing compared to the gratitude this patient had for our staff that day. She had said it was the first time she had felt anyone cared to try to communicate with her without an interpreter, and she was given an opportunity to ask questions with ease.
When was a time you were able to be creative in the workplace?
A time when I had to be creative in the workplace was when I floated to the emergency department for the first time. I was helping with tasks, and was helping a tech with placing a splint for a broken radius. There are standards with regards to the placement, but some creativity comes in when you are performing the task. It became almost an art form when we were asked to do a plaster splint because of the varying techniques. To make it smooth and functional, we had to be creative in the placement and cuts we made for the best results.
Tell me about a time you were the sole educator in a given situation. How did you ensure everyone understood?
At the last hospital I worked at, there were smaller committees of employees that were trained to use new devices and equipment. It was then that committee's job to ensure all employees on the unit were efficiently trained and able to safely handle the new device or equipment. I was on the committee that focused on safe patient handling and ergonomics on the floor. One training we had was for a lifting device that hoisted a patient up and allowed staff to not have to lift too much weight by themselves. I then reported back to each member of my own department and provided the training for this new tool that they could use. After I explained and demonstrated the use, I had each employee take the lead and had them use the lift to ensure they understood all the parts and mechanisms within it.
When was the last time you received constructive criticism? How did you respond?
The last time that I received constructive criticism was from a patient. The patient was extremely nervous about the medication he was about to receive and had many questions. He was upset that more information wasn't reviewed ahead of time for his first appointment. After I apologized, I explained that I was just about to do so. But in hindsight, many of his worries I easily could have addressed over the phone the day prior, when I had called to confirm his appointment. I now make sure to help patients anticipate their next appointment by being available for any questions and explaining as much as I can to them over the phone prior to their appointments.
How do you prioritize your patient's needs when you are given a full assignment and with numerous tasks to complete?
It is important for me to prioritize things based on how critical it is and how time-sensitive any given situation may be. By doing this, I am able to fully assess what needs to get done and when. With a full assignment, I have also learned to ask for help when I am struggling and delegate tasks throughout the shift when appropriate. Sometimes, this is not possible, and there is no one around to help, so I am left to critically think about what needs to get done first, and what can wait.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Hi, good morning. I'm your attending nurse, Francisco Magazine, here. How are you today?
I'm good. Thank you for asking. What about you?
I'm good. Thank you. Well, Sasha, I am happy to inform you that you are ready for the discharge. And I am here to discuss some information on your recovery and wound care after the discharge.
All right.
Sasha, may I know how you feel right now?
Actually, nurse, still my knee feels a bit painful, and it also looks very swollen. Although I feel a bit tired, I am looking forward to going home.
I am sorry to hear that you still feel pain and tired. However, Sasha, I can confirm that these are the usual side effects of the surgery. I can explain it in detail.
All right, nurse.
As part of the surgery, you have been provided anesthesia. Obviously, this will have some after effects. Some of the common after effects of anesthetic are tiredness, which you are currently experiencing, and lightheadedness. Perhaps, nothing to be alarmed about it. Your condition will improve in 48 hours.
That's okay.
Along with this, you can also expect some symptoms related to knee surgery. Post-operatively, pain and swelling on the knee are quite natural, like you suffer. I can assure you that it will gradually reduce. But the duration may vary from 1 to 12 weeks.
It's okay, nurse. I don't mind a bit of pain, as long as my knee gets better.
There are some ways to manage pain and swelling. One of the methods is to keep your leg in an elevated position. Elevation of the leg will help you to reduce swelling. Next is the application of a cold compress. It will reduce pain and make you feel much better. Along with these methods, try to take painkillers as needed. I suggest you to follow these measures to get rid of these after effects.
Sure, nurse. I will follow your suggestion.
Thank you for accepting my suggestions. Moving further, I would like to provide some advice to you on wound care management.
Sure, you may proceed.
Thank you. The first and foremost thing is to keep the dressing dry and well covered. In addition, it is very important to replace the dressing if it gets wet or falls off. Always remember to redress the wound after every 5 days. These steps will ensure better healing and make sure no infection is caused.
All right. I will keep these instructions in mind.
Good to hear, Sasha. Let me remind you about the stitches. Your stitches are dissolvable. This means it does not need to be removed, whereas it will get dissolved naturally.
Okay.
Nevertheless, you have to be vigilant and keep an eye on the infection. The signs of infection require medical attention. Some of the signs of infection include increased pain. Do not take it lightly if the pain is persistent. Next, check for the redness at the wound site. It also shows an abnormality in healing. Besides these, if you feel a high temperature, check the wound for any kinds of infection. I strongly recommend you to check these signs and seek medical attention at the earliest.
Sure, nurse. I will make sure to look after the wound, and I will look out for any signs of infection.
That's perfect. Well, Sasha, I would like to know whether you have someone to accompany you after the discharge.
Yes, of course. My sister is coming to drive me back home.
That's great. What about your assistants at home?
Well, nurse, I live on my own. So, I will be able to manage myself at home, and with the shopping. I don't need anyone to stay with me. I would like to have some time on my own to rest.
Being independent is good, and I appreciate it. But Sasha, since you have undergone surgery, and in fact, it is directly linked to mobility, it is essential to have support after the discharge. It is nothing but, you are restricted with mobility for better results, and weight bearing also should be strictly controlled, to ensure safer recovery. Therefore, it is mandatory to have someone to stay with you for the first 24 hours. And thereafter, to help with practical tasks, such as shopping.
Yes, nurse, I understand the importance of having support. I think it's a good idea for my sister to stay with me. I will talk to her about it.
That would be a good idea, Sasha. Always feel free for further queries. I wish you a faster recovery.
Thank you, nurse. That is the end of your OHE speaking roleplay. I wish you all the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.